Well, as an organization, we know how important it is to have good hand hygiene before we care for our patients. We want to prevent infections and provide the highest quality, safest care can, and that's still a major component in healthcare, the basics of hand washing.
When we were approached about doing the hand hygiene project, we had a couple goals in mind. We knew that we had areas that we can improve to get better at it, and also at the time, we were currently working on our own project to try to see if there's a way we can improve what we were currently doing. When we did brainstorming, we had frontline staff there, in addition to management staff, and we had our quality health department there from the hospital, and we talked about things that we were currently doing. The expectation for these admitting nurses is to go in, orient the patient to the room, do the normal admission assessment, but part of that process is also to provide education about what the plan is for the stay, but then we do the education piece on the hand sanitizer. And so it made sense to stick the hand sanitizer in there too, because it's all about prevention, it's all about taking care of themselves, and the family traditionally is always there on admit, or not always, but most of the time. They're there, and so you can hit them all at the same time.
I think they were excited about it. I think they're always looking for ways to communicate to the patient, and this one gave them permission to talk about this gel that's on their bedside table. And I also looked at it as the gel was also a reminder for the staff to do hand hygiene. It's not just about the patient and the family, but the staff also has that foremost in their mind, to wash their hands.
One thing that helped this project is that we were able to really engage the patient just by giving them a bottle of hand sanitizer at their bedside table and letting them know that, we are caring about you, and we want your family to understand how to wash their hands, and we want you to be able to have that ability. Even though you can't get up to a sink to wash your hands, you can do it here at the bedside. I think another benefit that we had from this was engaging the families and giving them permission to use the hand sanitizer that was in the room, because too often they might have thought that it was just for the staff and that they didn't have permission to use that product.
I also had to go to materials and say, because they had a limited quantity of those bottles on hand, and so they had to order a lot larger quantity and now make them available to housekeeping to put out, as opposed to just being in the supply room. So it was a multi-step process. We had our IT lady develop a new spot on the education tab in our electronic record, so that we could chart the education, because it wasn't something that we consistently were doing. And so she developed a new spot for us to chart on the admission. So there's this whole section on, was the education provided, who did you talk to, what did you do, all that kind of stuff. So that's nice. It gives us a nice way to track it.
Well, I think that we were successful with it, and it's a way that we have found to be successful, and we would like to move it out to other departments.
It's worthwhile. It's worthwhile. Your patients benefit, your staff benefits, the public benefits. It's a fabulous program.